Hi, in this video I'll be demonstrating on how to perform primary and secondary survey on a child, both child and adult. First thing first, while arriving at the scene, make sure to remain calm and while performing this video, I'll be using the mnemonics Dr. ABC and start off with D, it's danger, so you have to check for danger, check for any hazards or any objects that can cause injuries, and R is response. And checking for response, you just slightly tap on the casualty's shoulder and calling her for response. Like, hey, 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 can you hear me? If there's no response, call for help or ask a bystander to dial 911. While waiting for help, we can check for the casualty's airway, check if there's any obstruction or any blockage in the airway. Place your hand on the head, one hand on the head, and lift the chin with two fingers and tilting the head. Then check if there's any obstruction in the airway. And after checking for the airway, straight look for any signs of life or any signs of breathing by leaning forward to the casualty, listening for the what's the movement of the chest. If there's no sign of breathing, check for circulation by palpating the main arteries, which is the carotid and the radial artery. After checking for the circulation, we are ending with the primary survey, and now we're moving on to the secondary survey. And this is the survey where we provide information for the paramedics, and we have to put the casualty in a recovery position. So first, we're gonna lift her hand and leave it lateral to her head, and then lift the opposite arm and place it across the chest and above the opposing shoulder. And slowly lift up the knee and the leg, and then you turn her to the recovery position. Place her in a recovery position and then extend her legs forward. And as we wait for the paramedics, we palpate if there is any sign of deformities, any inflammation, any contusions, any bruises, or any swelling or tenderness and pain. So any forms of bleeding. By looking at these signs, we now palpate from head to toe, checking for any signs of bleeding. And we palpate the body, and then we look at any signs of bleeding. Thank you.